When San Francisco's first confirmed cases of the coronavirus emerged in early March, it seemed unclear how exactly we needed to fight the pandemic. Well, one woman decided that one of the best ways to help would be to arm communities with the most up-to-date information available, because when you know, you're less fearful. Those are the words from Diana Lau, the director of the Asian Health Institute at UCSF, and she joins us now from California. Thank you so much for being with us today, Diana. Let's talk first about this bilingual educational program. What is it about and how did it start?
Well, it started many years ago, and I was working as a nurse in a hospital where I realized that patients were not getting what we were trying to tell them. Even when the physicians and other people went in and tell them in English, of course. And a lot of our patients in San Francisco are bilingual patients, but there are a lot who are also not able to understand English too well. So as a consequence, I realized that even for people who were bilingual, when they were in a stressful situation, they don't quite get it
Right.
for what we try to tell them. And those were important things like before surgery, what you should do, and so on. So the program started after I moved over and worked at UCSF and had a chance to do some educational programs bilingually. And so that on a regular basis, give patient information on health matters that we feel that are important for them to know, prevention or even to prepare for certain events in a hospital. And that way they wouldn't be having to face the event imminently and then trying to learn right away in a stressful situation, in which cases, most people don't learn well anyways, whether you speak the language or not.
Right. So you target the Asian American community, or specifically the Chinese community, which actually makes up 1/3 of the population over in San Francisco, correct?
Chinese makes up a big part of the Asian community in San Francisco.
So what kinds of topics are discussed in your programs?
A lot of the programs that we discuss are chronic illnesses and self-management strategies. We only see the doctors once in a while, if at all, once or twice a year, hopefully. And we want patients to learn to take good care of themselves. And so a lot of the information on chronic diseases as to what they are, how to recognize the symptoms early so that they can get help early, and what to do and why they do it so that they can do it on their own on an everyday basis, and how to stay healthy, eat healthy, exercise, and all that. So we infuse those kind of information in not just patients, but members of the community in a bilingual format. And we are lucky that we have a lot of expertise within UCSF that physicians can teach patients directly.
Right.
And so we invite physicians to come and talk about a certain topic that is within their area of expertise. And then we actually interpret alongside with them during the class. And the best part is that when they come to class in person, they see the physician, they get to ask physicians questions on a very personal level at the end of the class. And that is really the best thing for our patients. Even if you go and see your own doctor, may not have the time to explain things to you
Right.
on a regular appointment.
Definitely. So when are these programs aired, or how can people participate, and are they still continuing today?
With the COVID pandemic, what we have been doing in San Francisco was since March 17 of this year, we have had this shelter-in-place order, which means that we all stay home.
Right.
And so large events, we have actually stopped holding these events in mid-February, knowing that the pandemic's coming. So we have not been holding classes in person, and we started doing things online and planning that to be mostly related to the pandemic facing us. So people would learn what we know at the moment. And this pandemic, nobody knows a lot about in the beginning, and we learn as we come along. Right. As to how it's infected, how should we protect ourselves, even the mask becomes a big item for discussion as to people have a lot of different feelings about masking, and that happens to be one of the most important things that we can do to protect ourselves. So all along, since the pandemic has come along, our topic of discussion has been on about the coronavirus, and those were town halls that we held, and they were held online, and so that people can join us.
Okay,
But the regular in-person classes has been stopped at this time.
Right, and we just aired a clip from one of those town hall meetings online that you've been having. So what's been the response like from the community, specifically the Chinese community?
The responses has been great because a lot of the programs, they were either done, they were mostly done in one language. And I haven't seen any program that's done bilingually yet. So our program's kind of unique. And the reason we do this bilingual program is that we realize that, especially for immigrants, oftentimes we are in a multi-generation family where one generation would speak, let's say, Chinese, one would speak English, and somewhere in the middle would be a generation that can understand Chinese but can't speak it. Yeah. And so there's all these different levels of language command as immigrants moved over, and then they have children. And so we want to have the program in a bilingual format so the family can watch it together, or that they would be watching the same program even if individually in their own rooms. But they would know what information is being talked about exactly because the information's being done in both languages.
Yeah, awesome.
Although it's not a directly translation program, but the information is very similar.
Very similar. Well, I can see this because, like you said, when you know, you are less fearful, right? Those are the words that you said. Diana Lau, Director of the Asian Health Institute at UCSF. Thank you so much for joining us today.
Thank you.